Okay, thank you. Nice to be here. Although I realize that so many of the topics I'm speaking have already been presented, and secondly, being non-native English speakers after good English, I will keep my thing in my bad English. So it is about challenges and opportunities to insurability, mainly with AI. Maybe a few words of my background that reveal how I see the situation. I am an actuary, but I have worked the better part of my life as a lobbyist. And it means I've been working between politicians, ministers, NGOs, and the industry, taking questions from these other stakeholders and trying to negotiate between those and insurers. The topical questions in Europe, for example, in the EU, is the right to be forgotten, mainly in the area of the so-called beating cancer plan, making it easier for cancer patients to get insurance. An issue in my country has been the underwriting of clients with mental health issues, how we treat them. Then in Europe, there's lots of discussion of what was mentioned in the first presentation on ethnicity or poverty premium. And EU is also putting forward some new regulation called the AI or Artificial Intelligence Act, where probably insurance will be considered a high-risk area, which puts more burden on how to look at things. Certainly, these issues are not only dealt with in the context of AI, but what I am talking is more about this AI issue. Does this go forward? Yes. And then what AI does in these areas: enhances accuracy, better predictive models, insurance fraud prevention, chatbots can enhance customer experience, can help in usage-based insurance, can automate processes. So far, so good, but actually, those were the answers by ChatGPT. What in my presentation will come, everything that's in green is from ChatGPT. I also asked from ChatGPT what can AI make insurance impossible when it is on a very exact level. I think the previous answers were not so good, but these are quite nice. Firstly, it says that we can end up in the situation that was mentioned in the first presentation, that there is no insurable risk left. The second is that premiums can get higher. The third is that some areas can be excluded. More or less what I will touch these issues, and I will comment on whether these three propositions are right. My talk is based on what we did in the Actuarial Association of Europe. We have the Artificial Intelligence Data Science Working Group, so it's an AIDS working group. And we produced a discussion paper on the challenges and opportunities AI presents to insurability. Was published in January this year. The authors are there. Also, Jonas is somewhere here, so if you put really difficult questions for me, I'll turn them to Jonas, who is better in answering them. The concept of insurability, first, we need to recap that. It is always about risk sharing and paying the correct premium. Then, to implement the insurance, we have always needed data. With this better data, better modeling, we can more accurately predict what will happen, and certainly it helps in putting the price correct. If the pricing is not correct, then there can be an inappropriate surplus, or it can, if the price is too high, it can mean that you have no customers, so then you won't get the surplus. Or then if the pricing is too low, there will be a shortfall, and you might get bankrupt by that. But we can ask then that, do we have the demon of Laplace now a reality? Laplace in 19th century forecasted that the progress will go to the direction where we know everything and we can more or less avoid stochastics because with good data and good theory, we can calculate everything. Actually, this might sound funny, but some people really believed in this. When I was studying in Finland, we had some scientific cooperation with Soviet scientists, and there was one guy coming to our university saying that this whole stochastics thing is something that belongs to capitalism, and in full socialism or full communism, everything is certain, so stochastics is not really necessary. And I think he was really serious about that at the time. But how about this? Then this Laplace demon, it maybe goes too far, but we have misgivings. So not only ChatGPT, but otherwise it's been claimed that insurance becomes obsolete with better and better analysis and forecasting tools, or at least it will change the information asymmetry situation, where traditionally clients have known better their situation and have been better in estimating their riskiness. With better data, we can think that insurers with their resources can forecast the situation of the client better than before. I would say that historically, of course, actuaries have used fairly coarse proxies to look at risks. For example, we have been using gender and age, whereas I've been thinking that if you knew of a person what he or she buys from the supermarket during the last 5 years, how often he or she goes to the gym, how he drives, and so on, then you couldn't care less whether he's male or female or the age, because you know much more of the situation. Well, then we look, in the paper we are looking at the conditions for insurability. We need large number of independent units. We need to understand the loss. We need an accidental loss. We need a large loss and affordable premium. Then we need to be able to estimate the loss or have probabilities. We need to limit correlation or limit catastrophically large losses. Then adverse selection, moral hazard, and insurance fraud need to be controlled. And also we need to be careful that public support does not crowd out private risk mutualization. Then when we take AI, there's one definition of AI. It's not so necessary to look at it, but just to recognize that in regulation, there always needs to be some kind of a definition of what we need with that, and Europeans are trying to put it on legislation, what is AI. Probably when it's in the regulation, it is already outdated with developments. But then when we looked at in the paper on insurability area, then We will have better tools, so certainly we still have the units. And I think this also already answers the question that does AI and data make insurance obsolete? Insurance does not compensate for probabilities. Insurance compensates for something that actually happens and so the real outcomes, which means that even if we knew with data analytics the probability is better, we are not certain of what will happen, and therefore there is and will be room for insurance, maybe even better room when we are better in differentiating between risks. Certainly this definite loss is becoming easier with better forecasting power. Accidental loss, well, as I said, we compensate for actual losses. Certainly, the information asymmetry may, to some extent, change here, but otherwise it will remain like this. Then about this large loss affordable premium issue, previously some cases could not be insured because the admin costs were too high. With better tools and AI, we can forecast that even smaller risks can be insured, and in this sense, the developments will expand the area of insurability. Continuing, well, catastrophic losses will remain, well, large, not much to do that, of course. Even there we can have better understanding of the correlations and better control of accumulations. Then adverse selection, in principle, better tools for insurers to avoid adverse selection, but on the other hand, we can easily anticipate that there will be platforms helping clients to look for the best terms and conditions from different insurers, and this can lead to difficulties in the area of adverse selection. Well, moral hazard is always there, and tools can help, but it will be there. Insurance fraud, there are tools to combat insurance fraud, but on the other hand, the criminals will have new tools also. So in that area, things go to both directions. So I think we can easily say that the first claim by ChatGPT is not correct. Insurance will remain a good tool for risk sharing also in the age of AI. But then there are these two propositions by ChatGPT that there can be, with differentiation, some clients will face too high premia, or certain risks might be left uninsured. Then I asked from ChatGPT whether it leads to discrimination of vulnerable clients, and more or less it says that algorithm can be biased, proxy variables can lead to indirect discrimination, lack of transparency can be a problem. So in that area, ChatGPT, I think, answers quite well. But about the affordability of insurance, well, with better differentiation, we will certainly be in a situation where some risks that have currently been insured become uninsurable, or at least the premium will be higher. But then, on the other hand, some risks that are currently left without cover are better understood and become affordably insurable. An example already of this has been in Finland, at least, the mental health issue, where some insurers have been able to introduce better underwriting tools that differentiate between different mental conditions and help people get along in that area. But then also, we can mention in this area that when admin costs get lower, then risks previously too expensive to insure can become insurable. But generally, I would say that if AI is going to live up to expectation, the result should be that in the future, more risks than previously will be eligible for coverage. So as such, the technology should not lead to a bad outcome. But as I said, some risks currently covered will no longer get insurance. It was interesting, actually, in the morning, in the minister's speech, who weighted better price signals from insurers. And actually, this is, well, better price signals become easier, but then one might ask whether it is fair to customers. The real issue in this area is that is insurance helping to avoid social exclusion, or is it exacerbating social exclusion? It was in the first presentation already discussed that some insurance products are so-called essential products that help social inclusion, while other products might be a little more in the area of luxury, which is good to have, but you can live without them. It is difficult to define something that is essential across all jurisdictions, because this one depends so much on the social security systems of different countries. For example, in my country, Finland, actually home insurance is one of the essential issues, because you cannot rent an apartment if you don't get insurance. In many countries, it might be health insurance. So to my mind, insurance should pay special attention to the areas that are understood to be essential, and make sure that in these areas, direct or indirect discrimination does not exist. Of course, in voluntary insurance, everything will not be possible. There needs to be price differentiation, there needs to be exclusion, but at least AI can help in better scientific foundation in underwriting and help to make it understandable what risks are insured and what are not. So my message for actuaries certainly then is that actuaries and also insurers need to make sure that all these technologies are used responsibly. The world, of course, also changes. Some 20 years ago, Europe introduced the ban on the use of gender, and I remember the discussions in our actuarial body. I think it was my idea which didn't come true, but I made the proposal that we should publish a press release saying that actuaries still think that sex is important. But it didn't come out after all, and thinking back now, I think it would have been foolish, because in today's situation, of course, we are less and less talking about binary gender differentiation. So things change, and actuaries must change accordingly. I think in the use of AI, we must look at our societies and how things change and adapt to that. And act as responsibly as required. What we at least need to do, the systems need to be designed in a responsible manner. We must thoroughly test our models, our systems, to avoid biases and direct or indirect discrimination. Then we must pay special attention to vulnerable groups, especially those who are doubly vulnerable, to take care that we act responsibly there. Often the case is that we use, so to say, scientific basis for risk, but the society uses a more subjective basis for risk evaluation, and there we must be careful. And then when things don't work in private insurance, we must flag the situation to politicians that there are problems we cannot solve. Okay, thank you, and happy to, and transparency, of course, is there. Happy to answer questions, and as I said, if they are difficult, then Jonas will help me.
Thank you very much, Esko. Perhaps before we start the general Q&A with all of the presenters, I have from the audience one question directly to you. It came in the middle of the talk, and you reflected a bit at the end, but I still would like to ask you, are we demonizing AI too much? When computerization started in the 70s and 80s, it was demonized that it will increase unemployment, make actuaries redundant, etc. But that hasn't happened, and we have become smarter with it. So won't AI make humans smarter after being challenged by AI?
I don't know whether humans will be smarter or not. I have understood that the amount of stupidity is a constant. It might help, and well, at least I'm not afraid of AI and data science in the sense that it would make actuaries or more or less generally anybody else redundant. Rather, and the experience from previous times is that technology makes some professions redundant, but generally increases welfare and employment.